Is Americares board member Steve Sadoff. Steve joined Americares board in 2014, shortly after retiring as chairman and CEO of Saks Incorporated. He is also co-chair of our program committee, and most importantly, he is a wonderful partner to Americares. Thank you, Steve.
Good morning, everybody, and it's an honor to be here today. Usually I stand in front of groups and talk about retail and the consumer and what's happening in the environment, and this is very, very different. So, it's something I've become very passionate about because there are so many healthcare issues in the world, and it's just wonderful to see what Americares is doing, the impact that it's having. Today we're going to be talking about partnerships, and Americares has over 1,000 partners around the world. And if you look at on an annual basis, whether it's the gift in kind programs or the direct services that are being provided, we're talking about $1 billion, give or take, a year of impact that we're having largely going into healthcare. And Americares is operating in, depends on what we define as a country. Puerto Rico, is that a country or part of the United States? But we're in, let's call it 7 or 8 countries with very, very major anchor positions, operating in over 30, by the end of this year, close to 30 countries. And as Christine said, distributing products in over 90 countries. And there's so many examples of partnerships because that's how Americares works. The foundation of Americares is partnerships. And today we're going to be talking about 2 of them, one of them in India and the other in Colombia/Venezuela, in terms of the impact that Americares is having. We're going to start with India, and roughly 29% of the Indian population lives in poverty. Poverty in an urbanization environment is rampant. It's the chronic disease is the leading cause of death in India, and Americares is at the center of it in partnership. We've been in the country since 2006, or since 1993, but 2006, Americares India was established, working with more than 170 partners in the country and having 7 mobile medical units in the Mumbai slums. And over time, we've served over 140,000 patients within the clinics. So we're going to be talking with 2 people. The first is going to be Shweta Rawat, who is the managing director of the Rural India Supporting Trust. And the Rural India Supporting Trust provides, and I'm going to ask her to talk a little bit about it, but it's to provide an improvement in the quality of life of those people facing challenging situations in India. And they quote, "The aim is to provide equal access to quality health care and education and provide a dignified livelihood for all people regardless of age, gender, caste, or religion." And the mobile health clinics is an important way that they've been supporting it. So let me start by having Shweta come up on the stage. And Shweta is the managing director of the trust, and she's based in the United States and goes back and forth. And with her speaking is going to be Shripad Desai. Shripad is the managing director of Americares India. So, Shripad. So, Shweta, why don't you just start, give us a little bit of background of the trust and how you see Americares and how you got involved with Americares.
Good morning, everyone. I want to thank Americares again for giving me this opportunity and for having this great convening. The Rural India Support Trust is actually 10 years old this year, and Americares is one of our oldest partners. We've been partnering with them since 2012. And like Steve said, the idea for the trust was to improve access to services across India for education and healthcare, and really provide services in the last mile villages, so to speak. So, and that's why for us, the mobile medical units was a fantastic experiment in the beginning, but it's really become one of the projects that we've scaled up, not just with Americares, but our other partners as well.
So how do you go about the process of choosing a partner, and what are the characteristics that you're looking for in a partnership?
When we first partnered with Americares, in fact, when I was getting ready for this summit, I have the first proposal that was sent to me in 2012. And at that time, I think you had one van running, and they were looking for funding for 2 more vans. And what impressed me even then was the technical research and the study that had already gone into the pilot project. And it was, the viability of it was very strong. And that was very impressive for me. And it allowed us to really put our trust into this organization and say, you know what, they really know what they're doing. And I think this is going to be a great way for us to see whether this project will help the people on the ground. And what also has impressed me in the 7 years that we've partnered with them since is not just Americares' ability to have a great long-lasting relationships, but it's just the technical expertise required to manage, large-scale medicinal distribution, as well as the disaster management component, which we have, through Americares, funded and supported disaster relief in India twice now, I think, most recently being the Kerala floods.
So Shripad, talk a little bit. One of the things, I'm going to let Shripad talk a little bit about not just what's going on with the mobile vans, but he's sort of a little bit of jack of all trades in terms of managing such a wide range of activities in India. Talk a little bit about the range of activities that you're doing, but also how you work with an organization like Shweta's, and how you think about making the dollars go as far as they do.
Sure. So, good morning, everyone. America's India operations is about 90 people now. So, when I joined in 2012, we were about 18 people. In terms of programs, yes, we focus on emergency response, since emergency has already been spoken about, and we have in the past responded to all major emergencies within the country as well as outside the country, including the Nepal earthquake. I'm proud to say that my team was in Nepal within 48 hours of the earthquake. So that's about the emergency response that we work along. In terms of the developmental programs, we have a very successful mobile health center program now running in the city of Mumbai and other parts of the country. We have a school health program which reaches out to about 30,000 children studying in the municipal schools in Mumbai. And we have a large health workforce safety program which focuses on health system strengthening and ensuring that the health workers are protected from infectious diseases. So that's really the work that we do. Talking about our relationship with RIST or the partnership with RIST, I go back to 2011 when the seed funding from Baxter International actually started the first mobile clinic. And if I have to, I was telling Shweta that if I have to say how the relationship has been, I will say that RIST partnership has been really transformative. Because when we look at the program that started with just launch of one van, today it is a mobile health center model. So it's really evolved, and I love to describe it in 4 acronyms. I love to call it as ABCD, which means that A stands for access to primary care for the urban poor. So here is a mobile clinic that has a qualified doctor and branded medicines which are offered to the people who are living in the slums of Mumbai. Second important focus is on B, which stands for behavioral change. So our trained health workers work with the communities, educating them on certain health habits. The C is capacity building. As some of you may know, in India, in addition to allopathy, we have other homeopathic medicines and Ayurveda. So there are these practitioners who are not qualified allopathic doctors, but they do exist and they do cater to the population. So the C of the model focuses on capacity building, which means that we are actually investing and building the capacity of this population so that they are able to offer a certain quality of care to the population there. And D finally focuses on the linkages, the referral linkages to the health facilities and the service providers. So as you will see that the model really, which started as one van, has evolved, and I would say thanks to RIST support. If I have to talk about what made this possible, I think RIST we see, because we do work with many partners. The difference, if I have to say about RIST, I think it's more of collaboration, co-creation and shared value. So it is never, I mean, it goes beyond, I don't know whether it's suitable platform, but RIST America's partnership is beyond writing a check, is what, my perception is. They have always been participative, involved. I mean, at operational level, we do have, quarterly reviews and monthly calls, but I think we talk more off the call than on the call. So, when the RIS team comes in field, they are actually on ground trying to understand what are the real issues, and then we come back and we sit at the drawing board and finding solutions together. I think that's what I would say is the difference that I find.
This whole issue of what makes a good relationship between and the partnership, you've talked a little bit about communications. Shweta, you want to just talk from your perspective on how you view a relationship and what makes a good one, what makes a bad one, and how does it really work in your mind?
Obviously we've been partnering for 7 years, so this is a good relationship for us. The capacity of an organization is one of the first things we look at if I had to give a grant to somebody, and not just the external capacity, but the internal capacity, how the team is, and whether they really have responsive, right people in who we are dealing with on a day-to-day basis. And like Shripad said, transparency is very important, and the willingness to listen. As a grantor, a lot of times when we meet with organizations, there's, especially in India, or I think in developing countries, where funding is always a rush and a race to get the right amount of funding. As a grantor, we feel very sensitive, because if we say something or might want to change or tweak the program a little bit in some way, it almost, the grantee feels, oh my God, what if they cut our funding off? What if we don't do this? So with Americares, there's this very open dialogue, and we've sat and talked about our projects together, how we can make them the best version of what they are really, and how we can service the most amount of people and really bring about behavioral change, like Shripad mentioned. And we have a very strict monitoring and evaluation policy in the Rural India Support Trust, and not just Americares, not just adheres to that policy, but really stays on top of, just even the not so fun things, like bringing in the quarterly reports and any kind of, material that we ask of them. So our relationship is very transparent, and it really flows very well for us.
And how frequent is the communication between the two organizations?
Quite often, I think. I mean, we have our executive director here, Paul. I think Shripad and Paul talk probably a few
Every
times.
month,
yeah, at least once a month they check in with each other, and and again, things are different. When the Kerala floods happened, I thought of Americares as the first. I knew they would be the first responders on the ground, so immediately my mind was in how do we get the funds to them to start the rescue rehabilitation efforts on the ground.
So this whole issue of transparency, communication, frequency, and when you have poor ones, where you've gotten the funding and then they take the money and run, basically, you've seen examples of lack of communication as well.
Yes, we've seen examples of lack of communication, lack of responsiveness to what the grantor would request of a program, because it also has to reflect our values. So I think that...
Okay. All right, let's hear anybody in the audience have questions for the two of them. Yes?
Could you restate I got the ABC, I did not hear the D.
The D is developing referral linkages
Okay.
with the healthcare providers and the health posts and the hospital network. So in each of the clinic area that we move in, we've already mapped who are the service providers there, and the community is then linked to them. So this is broadly, if I have to say, it's kind of, you're not going to be there for the lifetime. So the whole strategy works around you move into the community, you start providing them a certain quality of care, and I dare say we're kind of setting expectations from the community. In our absence, the communities go to these, so to say, non-allopathic doctors, and they're paying some money, but they are not getting the desired quality.
Welcome back to the Americares Partner Summit here in New York City. I'm AJ Gibson. We're live on Facebook all day long. Thanks for sticking with us, popping in for some of the talks and out here for some of the interviews. We've got a treat right now because we have Shweta Rawat, who actually just spoke,
Yes.
and now you're here with me.
Yep.
I want to give you the proper introduction because there's quite a lot of titles right here.
Yeah.
So I want to give you you've earned all of these. You're the Managing Director of the Rural India Support Trust.
Correct.
As well as the Chairperson for the Hans Foundation.
Correct.
So let's talk about your work with the Hans Foundation a bit and why you partner with Americares.
So both our foundations, the Rural India Support Trust and the Hans Foundation, were started in 2009. And the idea was that in India there's a big gap, especially in the last mile communities and villages, between with access to services. So and what we believe is that regardless of caste or sex or gender or education level, everyone should have access to healthcare, everyone should have access to a good school, and if you're disabled, you should have access to services that allow you a better quality of life. So keeping those principles in mind, we looked for partners that had the same mission and the same value, and our partnership with Americares was started in 2012. Today we fund 6 of the 8 medical vans that they run, but the first proposal was just for 2 vans, and we provide primary health care to the Mumbai slums, which are some of the most heavily populated and densely populated communities on the planet, I think. Yeah.
I was speaking with Kathy, actually. She's one of the organizers of this event, and she's helping us out with this live stream. And she was saying that your vans go into the slums of Mumbai about every 2 weeks,
Yeah.
and that people are ready. They wait in line. They need the services,
Yeah.
and these services are very important to them. What does that mean to you every time you see lives changed by the work that you're doing along with Americares?
Yeah, I think it's incredible to see just the rise in awareness and in rural communities, especially in I think semi-urban communities in India where there's a lot of growth and explosion, and oftentimes services cannot keep up with that increase in population. Just the fact that they have this reassurance that a doctor is coming to see them every 2 weeks, who really is invested and interested in their care, and not only is he seeing them and consulting with them, but he's providing a follow-through plan of where to go if there's a second level of referral needed. And India has a lot of invisible diseases, what we call. Diabetes is a big issue, hypertension, heart disease. So these are things that you only really find out about and can actually improve if you do consistent follow-up care. So the people know that 2 weeks later the same doctor will come back and check in on them, and I think that allows them that kind of comfort, and then they take their children with them, they get the communities involved. And Americares today has really, they have an amazing relationship, an amazing reputation within the community they're working because they've been there consistently.
Education,
exactly.
Yeah, access, commitment.
Yep,
all
exactly. Education and access, and they've branched off. They've seen how the communities, what kind of care is really needed, and for us, we have that flexibility in our funding that looks at our partnership and says, well, let's think about this also. So, we've tried to include electronic management of all their records. So it's something that any doctor, any referral doctor can access from anywhere. And so we asked them to tweak the program with that. What I'm looking forward to is a landscape study that we've asked Americares to complete of just the actual effectiveness of the project that we set out and did together, the mobile medical unit. And I think it's going to be the first of its kind in India. Nobody's really looked at the MMU effectiveness, and that hopefully will be completed soon at the end of this year.
It's incredible how technology can help save lives in real time.
Yeah, absolutely.
I want to know what keeps you optimistic about improving the health crisis in India, and what are some successes that have inspired you over your time working with these organizations and working with Americares?
Yeah, so I am very optimistic because I think that given the right access is key to so many things, and our foundation in India, we work with over 200 partners, and we've been funding for the past 10 years, and I've seen success stories where we've created a hospital where there were no hospitals, and now you'll see and you'll hear stories of people collecting money from the village and coming once a month, bringing all the sick people together to the hospital so they can see doctors, and access a primary and secondary level care. So it's just, and then the kids are, going to school, they're getting better nutrition, they're more responsive. We're looking at how, and again, you talked about technology. it's been a game changer, you know, especially in social development. I mean, we have better quality education. We have people looking at YouTube videos here. You know, we fund a teacher training program, and all these young 17, 18-year-olds who are just about to finish college are going on YouTube and showing me, you know, amazing teachers all across the world saying, this is what we want to do and this is how we practice. And so it's just the styles are changing, and the youth in India is so dynamic, and
They're being inspired by your work.
yeah, it's the other way around. I come back and I always feel more reaffirmed in my faith that, okay, we're on the right track, and you just meet such great people.
Well,
you know,
lastly, I
everyone.
think it speaks to the theme of the summit here today, resilience.
Yeah.
Share a story of resilience for the people of India, primarily those in more vulnerable areas in the slums of India who, you know, are just fighting the good fight every day and just trying to do the best they can for their family and their community.
Yeah, I think it's very, it's an eye-opener. I go back to India 3-4 times a year. I grew up there, and I just, you know, living here is a very different reality for me. I have 2 little girls who study here, so when I go back and even just around where my parents have a house, in the villages around there, and you look at the students and you ask them, and you see how much their families are making per day or even per month, and how much they can manage within that small amount. And these kids are still going to school. You know, when we go to meet them, they still wear their best Sunday best outfits. They'll come out, but they're so proud of what they do. And you know, in the north of India is Uttarakhand, a state where I'm from, and in 2013 there was a huge natural disaster there. There was a cloudburst, and it's a religious pilgrimage town, so over 100,000 people were affected over the matter of one day. And because of the landslides, rescue efforts were not able to reach within the first week. And there's some villages where they lost the entire male population of the village because they were all working at these sites. And I've gone and visited with these women, and you know, they're back on their feet. I mean, it's about life has to go on, and we have to do the best with what we have available to us. So.
That's not an example of resilience. I don't know what is.
Yeah.
Shweta, you are fantastic.
Thank
you
you
for all the work that you do.
Thank you.
And I look forward to actually going and seeing your talk later. I'll watch it back on the live stream.
Oh,
Because I was out
good.
here, I missed it, but I will watch it.
Thank you.
And best of luck moving forward in all that you do.
Yeah, thank you.
You guys stick around. We'll be right back.